are a lot of steps that are in the middle, for example, insemination, watching and grading embryos, transfers, biopsying for preimplantation genetic testing or PGT, freezing embryos, thawing embryos.
So it's morning for us. I'm going to introduce myself first. So my name is officially N. Jamir. Friends call me Jamie. And I work for an Indian startup called Subhak Health Tech. So I don't know about the rest of the countries, but in India, we have a lot of stigma around infertile couples, subfertile couples. And we make two products. One is a sperm washing machine, and the other one is a home insemination kit. But beyond selling these products, we wanted to go ahead and democratize the word infertility, make it more common so that people who hear the term do not feel anything, or we just want to destigmatize infertility. And so in our quest, we have started talking with different doctors around the world, and we have started talking with dietitians and with patients who have gone through fertility journey to share their journey so that together we can make enough noise to say, hey, subfertility is common and nobody should have to go through any kind of stigma. So that is our mission. Introduce yourself.
Absolutely. So my name is Jessica, and I am 30 years old. I live in Pennsylvania in the United States of America. I have been an embryologist for over 5 years now. Before that, I obtained my Master of Biomedical Science from Colorado State University. I worked for one clinic in North Carolina for over 4 years, and then I moved back to Pennsylvania, which is where I'm from, and I have been traveling as an embryologist. So I travel to different IVF clinics across the country, and I work as needed. So if they need someone to fill in, or if they're very busy and they need an extra set of hands, I'll come in and I'll help. So, which has been nice because I get to see how different clinics operate, and I've got to meet a lot of great people in the field. And then aside from that, I work on my Instagram, so Explaining IVF, which is an educational format for the public. And I'm in the process of compiling a book, which will be ready in the next year or so.
That is a lot. And I'm always fascinated with people who write. Instagram must take a lot of your time, right?
It did at first, but now that I've gotten a grasp on how to do everything, it's become a lot easier. But starting it up was a lot of work and a lot of time.
Yes. How long has it been?
It's been less than a year since I started.
Then that's
almost a year now.
Then that's phenomenal growth because you have quite a number of followers.
Yes, it's very popular, which just shows that there was a big need for that kind of content out there. There wasn't really much out there like it, and it just gave people a chance to see what was happening in the lab firsthand. And there really isn't much else out there. A lot of it's written. There aren't too many videos, and I think it just showed the immense need for that type of content.
Exactly, because till I saw your videos, I was familiar of the word embryology and an embryologist, but I wasn't sure exactly what they do. And people explain, but it's difficult to grasp it. All right. Then,
agreed.
Right. So then tell us your work.
Sure. So the embryologist job really starts at the egg retrieval procedure and pretty much ends at the transfer procedure. So there are a lot of steps that are in the middle, for example, insemination, watching and grading embryos, transfers, biopsying for preimplantation genetic testing or PGT, freezing embryos, thawing embryos. So I do all of that. At some labs, I work with other embryologists, and we, each do different tasks each day. And some labs, I'm the only embryologist, so I do everything.
So how long does it take normally from the process of egg retrieval to egg transfer?
It depends, because there are a lot of different treatment options that you can do. If you choose to do a fresh embryo transfer, meaning that the embryos are never frozen, it takes 5 days. Okay. However, if you choose to freeze the embryos, they can stay frozen indefinitely. So it could take years. before that transfer actually occurs. So a normal IVF cycle in the lab is about 7 days. And at that point, all of the embryos that are suitable for transfer are either transferred or frozen at that point.
Okay.
After that, our incubator conditions really aren't good enough for embryos to grow past 7 days.
All right. So does anywhere in the process, do you do a lot of testing, right? For example, genetic testing and all. Does it also take time?
Yes. So in order to do genetic testing, you have to biopsy an embryo, meaning that you have to use a laser and actually take about 5 cells from an embryo. So that part takes only a couple of minutes.
Oh.
However, you then but then you have to send the samples to a genetic testing company, and that process can take a couple of weeks. So normally from the time that they receive the samples, it can take about 2 weeks to get a result back.
Right. And then only once you determine that the genetic testing is fine, you can do the transfer. And this only happens in some cases, right? Not all the cases.
Right. So people can choose to do pre-implantation genetic testing, but not everybody does. But yes, if the embryos come back as genetically abnormal, they're not suitable for transfer, and most clinics will not transfer embryos that are abnormal.
Yes, and that leads to a higher chance of success in the long run.
If the embryos are genetically tested, it is believed that it will increase your chances of success. Some newer studies have found that in younger women, the genetic testing doesn't necessarily improve your success rates, but it can help improve your chance of it can help you to know ahead of time that you're transferring a genetically normal embryo, which can help with some of the mental struggles that people go through if they're transferring an embryo.
Okay. Yeah, so you brought up younger women. Is it a trend everywhere that younger people also suffer from infertility?
It definitely, infertility definitely can affect people of all ages, and that does include younger women. Now, what we primarily see with younger women is that they have something called PCOS or polycystic ovary syndrome. And that means that they might get a large number of eggs that mature or that can be retrieved, but a lot of the time the development or the quality of those eggs is not always the best. And so they can have poor embryo development. So we see a lot of PCOS cases in younger women. As women age, we tend to see more cases of women who have something called diminished ovarian reserve. And that just means that the number of eggs that are remaining in their ovaries is lower. And so they maybe don't have as many good eggs that can be retrieved. They might not be mature. They might not result in high quality embryos. It's definitely possible, but those are sort of the trends that we see.
What do you think causes this trend?
Well, I think that as far as the diminished ovarian reserve, that has to do with the fact that women are born with all of the eggs that they'll ever have. And so the eggs sit inside of our ovaries from the time that we're fetuses inside of our mothers or whoever is carrying us. And so with those are when the eggs are actually produced. And so they sit inside of the ovaries, and the trends just show that after about 35 years of age, there tends to be a decline in not only the quality, but the quantity of eggs that are inside of the ovaries. So we lose some every month as soon as we start menstruating. And then some of them are damaged from external factors like toxins or radiation, or even whatever is in our diet. There are a lot of things that can harm the quality and quantity of those eggs. But really, it's sort of just about the numbers, where we're born with so many and we just lose them over time. Some of them will degenerate over time. We lose some each menstrual cycle. And so by the time that women hit premenopause or menopause, there are very few eggs left in the ovaries. So that, I think, is what causes the diminished ovarian reserve. The polycystic ovary syndrome, ovarian syndrome, sometimes that's genetic. Sometimes it's caused by a hormonal imbalance. I don't know if there's any one cause. I think it could be a multitude of causes. But again, we primarily see that when women are in their 20s or early 30s.
Wonderful explanation. Thank you. Ma'am, after you've retrieved an egg and in the process of your work, do some embryos die or get arrested?
Yes, definitely. So on average, we expect about 50% of the fertilized eggs to become what are called usable blastocysts. So that means that they're suitable for transfer. They've developed enough that they're at the right stage of development, and they have a good number of cells, so they look normal in appearance. So yes, it's common to not have 100% of the fertilized eggs become what are called suitable blastocysts. We do expect about half.
Mm-hmm. But as long as you've got one which is successful, it's fine.
That's what we consider a successful cycle. We consider a healthy live birth a successful IVF cycle.
Mm-hmm. So eggs, and when you have mixed the semen and the egg, sperm and the egg, do you freeze it or do you keep it aside in a contained environment?
Right. So if after insemination occurs, the eggs will go into an incubator, and incubators are temperature and gas controlled to mimic the uterine environment. So they have a certain amount of carbon dioxide, oxygen, and nitrogen, and they also sit at a certain temperature inside of an incubator, and that allows for the embryo to develop. They sit inside a media called culture media, which contains certain components that the embryos need in order to develop. So we don't actually freeze them right away. We actually let them grow in the incubator for a couple of days before we freeze them. It's normally not until day 3, so 3 days after insemination, or day 5 or 6 or 7, that we look at those embryos, and that's when we can start to transfer them or freeze them.
Okay. And do you have to keep check on the growing embryo every day, or?
You don't have to. Some clinics do, and there are some machines called time lapse or embryoscope incubators, and you can actually, there's a small camera and you can actually watch the embryo develop every step of the way. But in other clinics that don't have those, no, they don't have to look at them every day. In fact, some clinics don't look at the embryos again until day 5, so 5 days after insemination. As soon as they know that fertilization has occurred, they leave the embryos go, and they don't disturb them again for 5 days.
So these incubators, how tiny are they?
The incubators themselves are actually quite large, but there are different kinds. There are what we call box incubators, and they almost sort of look like a little mini fridge, where you can open the door and inside. Yeah, now those are not as popular anymore. What's more common now are something called benchtop incubators, and they're probably about 3 feet by 2 feet. And they have chambers, so you can actually open different chambers and keep the dishes inside each chamber. So they're relatively large when you think about it. Like I said, I would say roughly 2 feet by 3 feet, maybe a little bit less. But one chamber is normally dedicated to one patient's dishes, and so the dishes are what contain the media where the embryos grow.
Did you mind the sex of an embryo around this time?
You will not know the sex of an embryo before it's transferred unless you do pre-implantation genetic testing. With that, though, there are some countries in the world that do not test for gender because they do not allow for gender selection of embryos. In the United States, we do test for the gender. Not everyone likes to know the gender, but it is something that is tested during pre-implantation genetic testing. But that would be the only way to know the gender of the embryo before it's transferred. Other than that, you would have to do the non-invasive prenatal testing or amniocentesis or something in order to find out the gender.
Great. You answered my next question about it being maybe against ethics to do testing, selective testing, right?
Right.
In your daily work, do you face the patient very often, or?
In the lab that I worked at for 4 years, we called the patients with their updates. So we called them the day after insemination, and then we called them on days 5, 6, and 7 if needed. Now, not every lab is like that. In some labs, the embryologists do not contact the patients. The nursing team or a designated staff member will contact the patients with their updates. But I'm used to contacting patients with their updates from the lab and answering questions. But again, that can vary from lab to lab.
So whose duty is it to speak to the client, let's say, and educate them in the process? Is it going to fall on you or the doctor?
No, that's something that should be discussed with the healthcare provider and the patient before the process, before IVF even occurs. And so that should be a detailed conversation that should be had between the patient, the partner, and the healthcare provider, the doctor or the physician assistant, whomever it may be. And consents need to be signed beforehand that go over the risks of the procedure and why we do each portion of the procedure. And it helps people to make informed decisions about their treatment. So like I said before, not every treatment plan is exactly the same. Some people may want to do pre-implantation genetic testing. Some people might want to do a fresh embryo transfer, but it's a discussion that's had beforehand with their healthcare provider.
Right. What made Jessica choose this career path?
I have always wanted to be an embryologist since I was in high school. So I've always had I took an anatomy and physiology, a biology class in high school, and I've always had a fascination with women's health and reproduction. And so at first I thought maybe I would be an OBGYN or some kind of doctor or a PA or something. And then I did a project in high school about sort of what I wanted to be when I grew up. And I thought, I like women's health and I like working in a lab. What's out there for me? And after doing some research, I learned all about IVF and embryology. And from there, it was just, that's what I set my career path toward, was becoming an embryologist. So I've known for a long time.
Well, not many people know for a long time what they want to do.
Right.
Yes. And I think that's your calling, because the work that you do, as far as I saw your work on Instagram, is a total game changer. And perhaps that's why the gravitation towards this stream. I'm looking forward to this.
Okay, I am too. Thank you.
All right. Thank you so much for this opportunity. God bless you.
Okay. You too. Okay, take care.
All right. Bye-bye.
Bye.